The Geriatric 5 M's, a framework to improve care for older adults, by Elizabeth Fung Dio and Andrea Schwartz, MD. Older adults form the fastest growing part of the American population. As we live longer and healthier lives, we need innovative approaches to improve the care for older patients. The Geriatric 5 M's are an innovative framework to help improve care for older patients. Developed by Dr. Mary Tinetti at Yale University and Drs. Frank Molnar and Allen Huang from the University of Ottawa in 2017. The Geriatric 5 M's are mobility, mind, medications, multi-complexity, and matters most. We will now give examples of how you can incorporate each one of these key components in evaluating an older adult. Mobility is the first component of the Geriatric 5 M's. We can evaluate mobility by assessing functional status, gait, balance, and fall risk. One can assess a patient's overall functional status by assessing activities of daily living, ADLs, and independent activities of daily living, IADLs. Two quick ways to evaluate a patient's mobility are measuring gait speed and checking a chair stand. First, identify and mark off 3 meters or 10 feet away on a floor. Place a standard armed chair at the beginning. Begin by having the patient sit back in the chair. Start timing the patient as soon as you instruct the patient to go. On your instruction, have the patient stand up from the chair, walk the marked 10 feet at a normal pace, turn, walk back to the chair, and sit down again. An older adult who takes greater than 12 seconds to complete this test is at risk for falling. Other things you should take note during this test is their gait, sway, or loss of balance, indicators that further evaluation may be needed. Refer slow walkers to physical therapy. Mind is the second component. Under mind, we think about meditation, memory, and mood. When evaluating an older adult, when there is a change in their current mental status, the differential diagnosis includes dementia, delirium, and depression. Always check vision and hearing before doing any cognitive testing, as this can greatly affect cognitive function. A quick screening test for cognitive impairment is the mini-cog. This involves having the patient repeat and remember the 3 words banana, sunrise, and chair, draw a clock setting the hands to 10 past 11, and recall the 3 words. If abnormal, pursue further testing such as MOCA or refer to a specialist such as geriatrics or neurology. If normal, you cannot rule out cognitive impairment. Always screen for delirium if a patient has a rapid change in mentation. If a patient has an acute change from baseline mental status, inattention, disorganized thinking, and altered mental status, use the mnemonic AIDA. Inattention can be tested by asking the patient to say the days of the week backwards. If off baseline, check a CAM, a confusion assessment method developed by Dr. Inoue and her colleagues. More information can be found at hospitalalderlifeprogram.org. Medications is the third component of the Geriatric 5 M's. We see a high prevalence of polypharmacy in older adults. Commonly, polypharmacy is the use of 5 or more medications, which poses a major risk for adverse side effects, interactions, falls, and increased mortality and morbidity rates. Check to see if new symptoms or adverse effects. Avoid high-risk medications for older adults by using a tool such as the AGS-Beers criteria or stop-start criteria to help with deciding and avoiding prescribing cascades. Deprescribing is used as a shared decision-making tool with the patient to decide which medications may be eliminated by weighing the benefits and harms. 2 great resources to aid in this process are deprescribing.org and medstopper.com. Multi-complexity is the fourth component of the Geriatric 5 M's. The prevalence of multiple chronic conditions increases with age, with over 80% of people over the age of 65 having multiple chronic conditions. This has a large impact on how bio, psycho, and social situations may play into a patient's everyday life. Discussing with patients what meaningful outcomes they can expect from a procedure for their age group and complexity will help in providing perspective on prognosis, priorities, and shared decision-making. Use a tool like eprognosis.org to help weigh the risks and benefits. Matters most is the 5th component of the Geriatric 5 M's. Understanding a patient's care preferences and values can inform their goals of care and better align treatment with goals. Matters most also includes advanced care planning, such as identifying a healthcare proxy, a person who's named to make healthcare decisions if the patient is physically or mentally unable to. Clinicians and patients need to have conversations to discuss what's important to a patient when it comes to their medical care and end-of-life wishes. Use a tool like prepareforyourcare.org or the conversationproject.org to help. The Geriatric 5Ms framework identifies key components for evaluation of an older adult. As we look into the future, it is important for all healthcare professionals to continue to work together to improve care for older adults. The Geriatric 5Ms, mobility, mind, medications, multi-complexity, and matters most, can help us provide the best care as we and our patients age.